Hi, and welcome to Sustainably Smart Talks, where we're going to bring you industry leads, academic researchers, and entrepreneurs working at the forefront of today's cutting-edge technology and sustainable smart ideas. If you're subscribed, you're going to get a lot of value. Today, I'm joined by my guest, Ali Tariq, a researcher at Loughborough University. Well, Tariq, would you like to introduce yourself to the viewers, what you do, and your views on sustainability?
Yeah, hi everyone. Yeah, first of all, it's a privilege to be on your podcast. I've heard that there have been a lot of research-oriented people who have been in here, and I think it's a privilege to be here. So talking about myself, I basically belong to the field of electrical engineering. And this is where I started my career from. And along the way, I just discovered myself. But at the same time, I also discovered what was needed in the market and in industry. I circumvented around renewable energy sector along the way, and then took it into industry as well. While I was transitioning into more of a corporate role myself and into project management cycle, I thought that it's also very imperative to look at sustainability, because sustainability was and has been one of the most pressing issues of the world, and it shapes up the current, the contemporary world order. So I thought that it's basically very imperative to see how the world is shaping up, and that was a pandemic time in 2020 and 21. I thought that I should discover more research into the field of sustainability. And this is when I basically got an offer from Loughborough University. So this has been my parent institute for my master's in postgraduate studies for renewable energy systems. And then I chose Loughborough for my research. And this is where I was placed into a position where I was able to work on developing some point-of-care diagnostic facilities and sensing tools. Well, I'll probably shine more light on its relevance with sustainability. But just to answer your question on sustainability, I think we have tunneled it to the aspect of just the energy and the relevant stuff with that.
And I think that's a bit of a short side if you do that.
Yes, there are a lot of other horizons to it, and this is what I would like to express further in this discussion today as well.
Yes, indeed. But let's give the viewers a bit of a overview background. So your academic foundation started where?
So I did my undergraduate degree in Pakistan, and this is where all my schooling was done. I was brought and bred in Pakistan throughout the time, and this was by the age of 25. I thought that it's also important to find more avenues outside, and this is when I chose Loughborough University. In fact, Loughborough University chose me because that's also a kind of a fact that I wasn't aware of this university. I was aware of European Union Renewable Energy Center, through which I was applying at different partner universities who were working on sustainability goals in Europe. So I was one of the 80 applicants in 2018 around the world who applied for that sustainability goal postgraduate degree, and this was funded by that Renewable Energy Center in Europe. So I chose my specialization to be solar photovoltaics, because I came from electrical engineering background. So that seemed to be much more of a natural alignment for me to be there as a specialization. And this is where the University of Loughborough is where that specialization was taught. So Loughborough University basically chose me for its specialization.
In addition to your academic experience that you had in Pakistan, you've had professional development, you've had industry experience. Walk us through a little bit of that industry experience, how that has shaped your postgraduate study, now doing your master's and your PhD.
Right. So soon after completing my undergraduate degree back in 2014, I was inclined to move to industry, The reason for that was that I wanted to see how the industrial climate in Pakistan is. We are not a very industrialized country, and we have got very few opportunities domestically. They're not in most indigenous examples of industries being expanding into what other global like industries are. So we basically had textile industry and energy industry. So which are kind of competing on the standards of some more international industries. So I worked in both. Basically, it was a conglomerate. It was a textile industry which also had powerhouses and power companies, and they were also more into retail as well. So it was kind of a huge group which had its footprint in lots of industries, and I thought that it's a good incubating ground to be there, and I gave myself good 4 years in industry. So in 2018, I thought that there's more redundancy in my role if I stay here. I was put into a project management role straight away. And that was a very good learning curve because it allowed me to discover lots of facets of how the project would be initiated, conceived, developed, designed, and then commissioned over the years, and then run. So over the entire life cycle of the project, you get a good learning throughout this time. So in 4 years, I completed almost around 3 projects. They were 2 of them were energy related. One was a gas-fired power plant. The other was a coal-fired power plant. So it was a good learning curve. But after 4 years, I thought that I must not get redundant in my role. So need to get more skills. And this is when I went for my postgraduate degree in renewable energy systems from Loughborough University. So I've been doing an intermittent kind of work in academic life. So I then went back to industry after completing my postgraduate degree.
Yes, indeed. So your current work right now looks at biosensors.
Yeah.
So why the pivot from renewable energy now into biosensors?
Yeah, so that's also interesting in a way because I came into my research on the notion of sustainability, and the project that was pitched at that time was electric vehicles and the new battery technologies. So there's been a lot of debate on lithium-ion batteries and the usage. They've been very efficient. They've been really potent in lots of applications. EV is being the one under discussion. So there was a lot of research, and has been mostly in the East, that they need to find alternative battery chemistries. Lithium-ion is too expensive, firstly. Secondly, it has got very scarce raw material spread around the world. So they want to find something which is more ubiquitous, something which is more reliable in terms of its supply chain. And most of it is basically coming from the metals that are more available around the world. So aluminum came up as one of the best candidate for it. So we basically carried on some of the research on aluminum-ion battery chemistries. So this was the onset of my research at Loughborough. But the kind of sensing tool that we were using to analyze the battery chemistries and how the physical and the chemical properties vary over the cycling of the electrochemical cell, it was a quartz crystal resonator that we were using. So quartz crystal resonator has been a very, very strong candidate for microbalance technique around the world. It has been used in biosensing applications for quite some time. So there was a lot of research done previously before me on biosensing, and then we took a paradigm shift, and we thought that battery chemistry is one of the fields that is very relevant, but we can dwell ourselves further into biosensing as well, because development of a battery chemistry using the sensing tool will not be a very, very attractive idea, because we probably would need some extra tools and analytical tools for that. So we then thought that it's better to go towards biosensing aspect. and using the same sensing platform. So this is where the paradigm shift took place, and we have now resorted more towards biological testing and the samples.
Okay, can you explore the impact on how this will actually solve real world problems, the research you're doing at the moment?
Right. So there was a case study that I came across while I was attending a conference in Oxford, and I had the chance and opportunity to interact with a group of people who have worked on development of a point of care testing during COVID time. So I'm talking about March 2020 now. So in March 2020, the UK government had a meeting, a COBRA meeting, in which they decided that they need to go for a lockdown. They were probably one of the fewest of the countries who decided to go for it till the last moment. So there was a bit of complacency initially, but this complacency was because there was no vivid idea amongst the decision makers and the policy makers that how this situation will pan out.
Okay.
Pandemic was a kind of a situation that had not been there for a while. So this came out as one of the pressing issue that we needed to limit the global impact of it, because people were traveling. You can't restrict people from traveling, and that mobility and how the flights were going on from one east to west, the disease was spreading. So there was a lot of concern about it. So Oxford University was given this role that they have to find out a point of care testing solution which could be deployed at the airport. So there was a 30-minute estimation that once a passenger gets to the airport to board a flight, the passenger would get to the gate to board the airplane in 30 minutes.
Okay,
that's an average time. So they gave a like a kind of a target time for clinicians and academics around that they have to get a rapid test result. We don't have time for sophisticated lab testing, which would go and bring results in 48 hours. So they need a result in 30 minutes. So the labs were set up inside the airports, and the samples were taken there and then, and there was some sort of success with that.
Yes, indeed.
That was the concept. And since then, the point of care testing, which is that you extend the sensing to the patient at the point of care so that you get the results and you're able to decide on that. And this was so successful that we want to implement this in healthcare sector across the board, not just in hospitals, but also extend it to community at large as well.
Yes, indeed.
Because patients are spread all over the world. They're not just in the hospitals or healthcare settings or clinical settings. They're in houses, they're in care homes, they're in schools, they are in different community centers. They're everywhere. So we have tried to come up with a concept that was developed 5 years ago, and we want to extend that not just to pandemic situations, but to all other diseases which are prevalent, and we need to just provide a solution. As a researcher, that is our job.
Yes, indeed. So what would you say the broader implications of your research in terms of policy, society, and industry adoption?
So if you talk, they all come in a sequence. So firstly, there's a dearth of point of care testing in industry because this is a very much regulated industry. Healthcare is a very sensitive industry. There's so many regulations, they're very stringent. So there's a high threshold or barrier to enter this industry. So you need to be on top of your game to be there. So, you might have heard about so many products, diagnostic products, therapeutic products, or even drugs as well, who get FDA approval, which is basically a drug administrative authority of US. So if you get an FDA approval, you are essentially gaining access to the global market. So this is how how stringent the market itself is in accepting these products and accepting the kind of solutions that you have to offer as a researcher. The idea about our research is in order to gain access to industry, society, is that we want to come up with at least a lab-based product which could be tested on samples from real world.
Okay.
So like I'll be honest with you in terms of how we sample that. So we already have got access to clinicians in India and China and Southeast Asian countries who have shared with us the samples from the patients of that demographic or that area or the region, and they want us to come up with a solution in which they can test those samples at the location. For instance, if I just talk about two of them, one is a urinary tract infection. So it is an infection which is quite prevalent. That's a hospital-borne disease as well, in terms of that you are going to apply some catheter to the patients. So patients usually don't develop it before coming to a healthcare setting. In fact, they develop it after they come into the healthcare setting. And the second aspect that we have worked on is the disease aspect, is that there is a certain lung disease which is prevalent in India, China, and some of the Southeast Asian countries as well, which comes from the quarrying industry. So the stone breaking industry. So there's a certain kind of protein biomarker that highlights within your body if you have a very strong concentration of the particulate matter that is in the air. So the countries which have a lower air quality index have those. So they want to come up with a very simplified, low-cost solution of testing those people and trying to act preemptively to mitigate it.
Yes, and these sensors, paint a picture of how they kind of look like, how the integration is into these systems, how they look like. So
right.
People can imagine about how it would look like.
Yeah. So I'll just give a perspective of why we have come up with this system and how we have miniaturized and how convenient we have made these sensors. We have had these dipstick models. These dipstick models, or rather, we have those lab microfluidic chips. How they operate is, you might have seen that elderly and frail people at the home, they do some glucose testing or sugar testing. So they just prick their thumb or finger and they just insert a droplet of blood onto that dipstick. And that dipstick, through a capillary reaction, is able to transmit blood into the sensor and able to give some results. That's a very, very crude and simplified example of point of care testing. And they can do it after breakfast, before breakfast, which they call as fasting and random. So just to give a context on that. So this is how simplified and how miniaturized our sensor is going to look like. Okay. Right? So it's going to be a handheld kind of a sensor, maybe sitting on the palm of the patient. It could be administered by a clinician as well, because if you want to have it at a point of care, then you might want to have someone who can analyze the results, but it's very convenient to have that. So it's going to be deployed in large numbers, and it could be reused again and again based on the kind of deployment it's going to have. So if I talk about the other one, which is the UTI, it's basically going to be installed in the catheter. So the urine is going to pass through this sensor.
Yes, indeed.
And any anomalies of protein binding throughout the process, it will just spike up and will be able to give a result on that. So it's going to be giving a real-time detection of the patient's fluid. So, and if you want a cleaning mechanism, you can just close one valve, open the other, the urine will block, and you will have a cleaning mechanism of the sensor for it to be reused again.
Yes, indeed. One thing that comes a part of implementing these technologies is that people need to be educated how to use them. What's your approach for teaching and making sure people are educated to know how to integrate the systems into the danger zones or into their daily lives? What would you say is your teaching approach for that?
Firstly, the sensor itself is of a non-invasive quality. Like, it does not allow samples to be taken from the blood. So in case of those testing solutions in which you have to prick the body in order to get to the blood or serum or extract any body fluid, needs to be administered by a trained clinician. and cannot be left up to the patient unless they undergo certain kind of training. So firstly, our sensing solution is going to be non-invasive. Okay. So it's just going to take samples from the body fluids such as sweat, urine, or saliva, so which are more non-invasive studies. Secondly, because it is something which is more miniaturized and it's able to be deployed at various locations in external environment as well, could be operating outdoor as well. So maybe within just a couple of sessions, or just as I mentioned that on the dipstick model, which we have, people can get hold of the testing part as well. So it's not very, very complex. So secondly, we as a pilot project, we want to have this deployed under the guidance of a clinician, so that people would know how to operate this kind of a sensor instrument. It's not very expensive, it's very cheap.
Yes.
And I don't think so there's any high social cost associated with it in terms of doing any malpractice with that, because it does not have any hazards as such associated with it.
Yes, indeed.
There are no biological samples which are taken through invasive methods, and there are no contamination related aspects to it, that if someone uses it after another person or patient has used it, so there's a cross contamination that could occur, so that effect is also not there. Okay. So this makes it much more viable to be used by a range of people around the world and be reused again and again.
Yes, indeed. You brought up the effect of costs. I wanted to ask for adoption to these lower middle income countries. How feasible is it, and what's the cost that we're looking to deploy that on a massive scale? Right. So, because you usually need like 36 tons or tons of medicine for at least like 2.5 million people.
Right. So the cost is that we are aiming is less than $1, which we still think that it's still high for us. We want to keep it lower because we want to deploy it in low income countries, where we want to bring it into their own domestic currency less than, if you talk about India, we want to bring it less than 150 or 100 rupees, which is maybe less than a pound. Okay. And similarly, if we want to deploy it in African countries, we want to bring it even lower. So this is how you achieve economies of scale with that as well. But the model that we have in terms of the pricing and the costing is similar to what is in the microfluidic or the dipstick models, which are like everywhere around the world for different diseases. They have developed dipstick models in which they sense the different kind of bacterial diseases among people, and women all around the world also use it for diagnosis as well, or for say pregnancy tests are usually done with that as well. So they are more efficient. They're very effective as well, but they are more effective nowadays to be used in those disease biomarkers which are more potent to be shown with a higher concentration. What we are talking about is where the disease is prevalent, but it's in such a low concentration inside your body that it just doesn't show up in form of symptoms or of any biomarkers. So you want to get to a lower limit of sensitivity in order to get there. The problem with these kind of prevalent devices was that they need a certain amount of threshold of concentration. Otherwise, you get a false positive and negative values. So we want to work on more sensitivity as well.
Okay.
That has been a debate.
Okay, talking about that, so any successes or failures coming during your research, any key achievements, how's that gone in your day-to-day lab environment?
Yes, this is quite challenging, essentially because of you're playing with the nature. You're dealing with such small concentrations, and secondly, you're trying to develop some novel strategies of capturing these molecules. And these molecules are like what we call as the villains in our case, because they are very small molecules. They are in very small concentration, and they might show up and might not show up, or they might not get captured. So we firstly want to develop a very, very strong and specific capturing site for them to basically allow them to be captured in and then measured. So the only thing that defines a sensor is its ability to sense and capture things. If it's not able to capture, then it's probably not a sensor at all. So there have been lots of sensors around the world, lab-based sensors. They're very sophisticated. They're chemical-based as well. They're electrochemical-based as well. We want to fight them in terms of time, cost, and convenience.
Yes, indeed. Well, thank you for sharing that. So where can people follow your work, your details? Is there any way they can follow any journals, any publication that you've made regarding this work?
Yeah, so there are 2 papers that are under review right now, and there's 1 journal paper that we are working on. This is going to talk about a certain assay development, which is basically, in layman terms, I would call it a binding site for these disease biomarkers. That has to be very specific. So if you develop a good binding site for that disease biomarkers, that is a game changer. And that could be used across different sensing platforms by a lot of people all around the world. So coming up to that point is a big contribution to the research itself. This is a research in its nascent stages right now, because development of assay is quite a job. If you have developed it, people are going to use it.
Exactly.
We are sitting on the shoulders of those giants who have developed these assays for those diseases, which we are able to fight nowadays. But there are so many diseases around the world which we aren't able to find out in there, like cancer. Cancer is one of the menace that we aren't able to find out. If we are able to detect it in early stage, there's a high chance that we can curb its effects.
Exactly.
So this journal paper that I'm working on is basically development of that assay, and then its application would involve, as I mentioned, how am I going to use it in a different kind of diseases such as UTIs, for different disease biomarkers, or per se we can use it for cancer biomarkers as well.
Well, yeah, cool. Seems like you're making a lot of impact for research. Well, Tariq, thank you for joining us today. As we promised, this is Sustainably Smart Talks. We were going to bring people working at the forefront of academia, industry, giving us what is relevant to this day, making us be able to have a sustainable future. Well, thank you again for your time.
Thank you. Thank you, AJ. Appreciate that.